My name is Dr. Patrick McGahan, and I'm an orthopedic surgeon at Advanced Orthopedics and Sports Medicine. The goal of this video today is to show a quick physical examination that can quickly evaluate and diagnose 90% of shoulder problems. Remember, in this scenario, we're talking about chronic shoulder problems where patients had pain greater than 6 weeks. In addition, it can be a situation where patients had a remote history of trauma followed by a prolonged period of pain. This is not the examination that will be done in acute settings. When you have an acute injury and a patient is in severe pain, this will often lower the threshold for advanced imaging, and I recommend an urgent MRI. The handout here is a handout that is on the presentation, and this will diagnose the 8 most common shoulder pathologies. With a combination of a quick history, as demonstrated on the flow chart with a focused physical examination, you can successfully diagnose the 8 most common chronic shoulder conditions. These are adhesive capsulitis or frozen shoulder, arthritis, rotator cuff tear, impingement syndrome, superior labral tear or instability, AC joint arthritis, and biceps tendonitis. In the first column are the classic history that's obtained with these diagnoses. In the third column are the physical exam findings, and that's what we'll demonstrate today. I will first go through the examination quickly so that you can see how quick it can be performed. Then I will go back through it, demonstrating the physical examination and the findings. As I walk into the room, I first ask a patient to demonstrate their range of motion. Then bring your arms out. Resist me. Is that painful?
Yes.
Okay. Bring your arm over here. Resist me. Is that painful?
Yes.
Okay. Is that painful?
Yes.
Okay. Relax. Is there pain over your AC joint?
Yes.
Okay. Is there pain over your biceps tendon, the bicep groove?
Yes.
As you saw, that exam took less than 1 minute. And with that quick exam, you can diagnose the 8 most common diagnoses. Now we'll go through that exam again, demonstrating what I'm thinking in my mind as I speak out loud. This is my normal internal monologue as I'm examining the patient. All right, can you show me your range of motion? Back of the head, and relax. The patient has full range of motion. In the setting of a painful shoulder with full range of motion, then you know the diagnosis is neither adhesive capsulitis or arthritis. Both of these conditions cause a loss of range of motion. The next test is the Job's test. Bring your arm out. Resist me. Is that painful?
Yes.
Pain and weakness with this test indicates a high suspicion for a supraspinatus rotator cuff tear. Relax. Is this painful?
Yes.
Next is the impingement test. This test will be painful in both rotator cuff tendonitis as well as a rotator cuff tear. Distinguish this from a rotator cuff tear with weakness with rotator cuff testing. Next, I bring the arm across. Resist me. Is that painful?
Yes.
This is the O'Brien's tear, which is the O'Brien's test, which indicates superior labral pathology. A positive test with pain raises suspicion for a superior labral tear. Next, I bring the arm down and I directly palpate the AC joint and ask if there's pain. Is this painful?
Yes.
In this situation, pain upon palpation and a patient's history of superior shoulder pain can indicate AC joint osteoarthritis. Next, I palpate the biceps tendon and the bicipital groove. Is this painful?
Yep.
A positive finding along with a patient complaint of anterior shoulder pain will indicate biceps tendonitis. With this simple test combined with my handout indicating the flow chart of a patient history combined with the physical examination, one can easily identify 90% of shoulder pathology with a chronic painful shoulder. There are 2 additional tests that you may use in the setting of a concern for shoulder instability or shoulder dislocation. I ask the patient to lay supine and I gently externally rotate their shoulder as if they're throwing a baseball or football and ask if they're experiencing any apprehension. Are you concerned your shoulder is going to pop out?
Yes.
A positive test is when a patient feels uncomfortable as the shoulder is brought back into the cocking motion. I then ask if that apprehension is relieved with a posterior directed force. Does this make your shoulder feel more secure or better?
Yeah, makes it feel better.
Great. That is a positive relocation test, meaning with a posterior directed force, the patient feels relieved. The final test is called the jerk test, where you bring the arm across the body and press a posteriorly directed force. Pain with this test indicates a posterior labral tear. All right, now sit up. So now that I've gone through the exam once, I've then explained the different examination maneuvers, I'll show you that how in my patient population I can perform a quick examination in less than a minute. And then when I have positive findings, I'll often do additional tests to supplement these. But these are a good screening exam for 90% of patients, which will indicate their shoulder pathology. Can you raise your arms for me? In the back of your head? Good, you have full range of motion, so I do not believe you have adhesive capsulitis or arthritis. Do you have pain?
No.
You have full strength of your supraspinatus, so I do not think there's a tear. Is this painful?
No.
Your impingement test is negative as well. Resist me? Is that painful?
No.
That is the O'Brien's test for the superior labrum, which is negative as well. Any pain in your AC joint?
No.
How about in the biceps tendon?
No pain.
Okay, can you lay back for me? All right. Is this making you feel apprehensive or as if your shoulder is going to pop out?
No.
Okay. Does that change your feeling?
Yes.
Okay. And is there any pain as I push posteriorly on your humerus?
No.
Okay, fantastic. Please sit up. As you can see with that examination, talking the patient through it, using the flow chart, 90% of chronic shoulder pathology can be diagnosed with a simple history and a 1 minute focused physical examination. Thank you. And as you see the patients, please refer to the handout, including the history coupled with a physical examination for a quick and accurate diagnosis.